Hey, Ollie Matthews here, certified functional medicine health consultant, nutritionist, and health coach. Now, one of the most common things that I see within my clinic is people coming to me saying that they have acid reflux, that they don't know what to do, they've got acid reflux, and then the other thing that comes with that is that they've been prescribed lansoprazole from their GP. Now, what I want to get clear at this video is not to diagnose, it's not to say treat exactly like this, but this is to say what could be going on and to say go and speak to a professional if you want to have more information. And if that professional is myself, drop me a message and we can get on a call. Now, lansoprazole, it's a medication that is widely prescribed for acid reflux. It's also used for things like stomach ulcers, for H. pylori infections and other things. But for the purpose of this video, we're going to be speaking about acid reflux specifically and using something like lansoprazole, which is in the family of proton pump inhibitors, which is probably the most common medication that I see get prescribed to clients. Now, a proton pump is within your stomach, which actually pumps out acid, which is a good thing because we need acid, we need hydrochloric acid, we need stomach acid, whatever we want to call it, in order to break down our food, in order to digest proteins, the building blocks for our whole entire body. Now, also what happens is when you have enough stomach acid, it signals other enzymes to digest carbohydrates and fats as well. And also then helps break down those nutrients further down the line where we then have the building blocks for good hormones, good energy, good brain function, good detoxification, and so forth. Now, when we digest our food, we should have signals from our brain. If we've got a good, healthy brain and we think about food, we should be sending signals to our brain or from our brain to our mouth, salivary glands, to our gut to produce enzymes, produce saliva, and then to produce enzymes further down the line. And what actually happens is the problem comes is when there's high levels of stress, there's excess levels of stress, that we don't get these signals to produce these enzymes in order to digest the food. Now, as a result, people think that there's this reflux because there's too much stomach acid. But 99 times out of 100, reflux is caused by low stomach acid, not high stomach acid. Now, this proton pump inhibitor, something like lansoprazole, inhibits them proton pumps from producing enough acid and producing acid at all. As a result, we then have low stomach acid already, which gets even lower, non-existent, and that could be causing you hormone issues, low energy, and further health problems further down the line. Because we also need things like stomach acid to help with iron production as well. And when we can't get the right nutrients from food, we then start to see deficiencies happen. When we can't break down that food, we get those deficiencies happen. So we have deficiencies from malabsorption. Now, if we can't break down that food, like if we've got high levels of stress and these proton pumps aren't working, that food just goes and sits in our stomach. If we've not got the acid to break it down, then that food just goes rancid. And what happens is this gas then comes further up. It comes further up that then we get this reflux happen. And we should have this door. We all have a door, esophageal sphincter it's called. In our esophagus, that is essentially the doorway to our gut. Now, I always describe it as if you live in an old house, like we live in a really old house. It's, well, I say really old, it's 100 odd years old. But wooden doors, it warps and the floors start to go all over the show. Now, what happens there is there's draft. There's airflow going through. And this is what happens with this esophageal sphincter. When there's high levels of stress, potentially causing inflammation, this doorway just doesn't fit the gap. So this gas comes up from rancid food that hasn't been digested properly because stress has impacted the amount of stomach acid. Then we then get this reflux. So having that lansoprazole, something which inhibits the proton pumps from actually creating stomach acid, which is already low, is going to cause more problems, more harm than good, pretty much all the time. And as a result, as I've said, it's going to impact the ability to absorb iron, absorb calcium, absorb magnesium, absorb B12, absorb vitamin C. And these are all vicious circles because they all work synergistically to help other vitamins and minerals absorb, help other processes within the body, help hormone production, and so forth. In fact, it's actually been seen if you look on PubMed and if you search proton pump inhibitors with iron absorption, with hormones, with protein, with pregnancy, all these sorts of things, you will find hundreds of studies. There are pretty much all negative impacts. And in pregnant women specifically, PPIs bring a risk of congenital malformations. They bring a risk to problems in that pregnancy. They become a risk of more UTIs, more urinary tract infections, and things like hyperchlorhydria caused by chronic PPI use. Now, we're saying chronic. We're saying long-term PPI use, being around 3 months and more. And that's linked with gastric polyps, with carcinoids, and even things like gastric cancer. But the thing I really want to focus on, because I've been through my own fertility journey, and that is the impact on fertility and hormone production. Now, two specific studies in particular. One is on humans, the other one is on rats. So depending on how you believe with that, I would prefer both the studies to be on humans, but I was just very interested in the results of these studies. But this study is first one, which was published in November last year, 2023. Effects of long-term proton pump inhibitor use on sexual hormones and sexual and reproductive health in female patients. Now, they looked at 101 different patients that were on proton pump inhibitors for 3 months or more. And they found that there were endocrine hormone disturbances which were leading to sexual difficulties within those women. And the second study is that the harmful consequences of proton pump inhibitors on male fertility, and evidence from subchronic toxicity study of lansoprazole in Worcester rats. Now, this was in rats, but what they found, now if you see a lot of studies are being done in rats, because a lot of times if they're looking for negative issues, how are you going to find the people that want to volunteer? Say, oh, you're looking for negative issues with proton pump inhibitors, which might impact my testosterone, sperm count, motility, and all these sorts of things. Yeah, I'll do it. You're not going to get many volunteers for this. Now, they found that it impacted sperm count, sperm motility, and sperm morphology. Those levels declined. Then testosterone declined. It impacted follicular stimulating hormone, FSH, and luteinizing hormone, LH. So we're looking at, again, production of sperm, production of testosterone, and it also increased oxidative stress, which is then going to have further impact on other systems within the body. Now, it's all well and good to think this is a negative thing, and we're having GPs prescribe this left, right, and center. Now, I honestly think that if GPs had longer with their patients, I would like to think that they would look more into the lifestyle interventions that could actually happen and cause negative, less side effects. So what can we do? It's all good to say, just don't stress. But stress is the biggest thing that is causing the problem with acid reflux. Now, I get frustrated if someone says don't stress. It just stresses me out more. Well, you know what you need to do? Ollie, just do not stress. That's not going to work, right? But when we look at what is causing the stress, it's usually down to 3 things: environmental stress, psychological stress, or physical stress. Physical and environmental do cross over. But we find that environmental stress, we're getting more and more knowledge about this, but there's a definite link with our environment, with the air quality. For example, we live in a place called Norwich, Norfolk, which is a farming county. And there's a lot of farms, there's a lot of fields, there's a lot of countryside here. But that doesn't automatically mean the air quality is great. Yes, you may not have as many diesel fumes, but you've got a lot of pesticides and chemicals being used on those fields, which then impact the air quality further down the line. Now, so what we need to get good airflow, yes, but we also look at the environment we live in. Now, we've had problems with mold. When I get exposed to mold, I get migraines. And I can tell when I've been exposed to mold because I get clusters of migraines. And then I lose my vision. I start to get numb hands. And I know that I've got to get into the bedroom and just go to sleep. And it's horrible because you then get post migraine syndrome where the next day you just feel so tired. And I will get 5, 6, 7 of them in a week when I'm exposed to mold. It's not a nice thing to have. And people have other issues where they have digestive issues come from mold, they have severe brain fog, then that can have other issues further down the line. And that causes other stress, which then, as we said, impacts our gut, which can impact that reflux. So looking at your environment around you, in fact, I had one client that couldn't see what was going on with their gut and with their reflux until COVID happened. Now, what happened that when we had lockdowns is that she ended up that she didn't have to use her car for 4 weeks. And all of a sudden she felt better. And then she started using her car just for the odd journey. And every time she got in her car, because her body had this time to detox, she then started feeling like so much more brain fog. And it turns out under the mats of her car, there was a lot of mold. There was damp in the car. And when she switched her car, that then improved their health. So it's vital that we find the root cause of the issues. Usually we start down here in the gut when actually it's up here in the brain sending signals to here and here. So how can we improve here? With the environment sometimes. Now, we also have to look at the psychological aspect of stress. Now, I'm not a psychiatrist or psychologist or whatever we want to look at here, but the perception of stress is so, so powerful. How we can feel that stress, how we believe what we believe. And I'm very religious and I believe God's got a plan for me. But that doesn't always help in the moment when I have to remind myself that I'm super, super stressed. And then this is all in God's plan. Now, if we can respond differently in the moment to that stress, we can sometimes look at the stress response to the body and that then impacts it differently. But what does financial stress mean? What does relationship stress mean? But what about family stress? There's a lot of stress there. And as I say, I'm not an expert in fixing those stresses on the body, but I am an expert in looking at the nutrition and how our body should function and looking at the functional medicine, the lifestyle interventions that could help you be able to tolerate that stress better. And then we have to look at the physical stress coming from your food, looking at making sure you're getting enough good quality protein and good quality nutrients that is going to allow your body to absorb the right nutrients. Things like if someone's vegan and they're struggling with energy, they might be having, well, they're definitely going to be having too little ferrous iron and having too much ferric iron, which isn't going to be absorbed very well. And so they're going to be deficiencies further down the line. And then it could lead to reflux and then hormone issues. Then the same as someone goes carnivore, goes completely extreme the other way and not getting the right levels of fiber. Like, let's not go extreme with our diet. But we can look at having a real food, whole food diet as much as possible. And if you know something doesn't agree with you, if you know something makes you feel bad, I hear people say, I feel just horrible when I have bread. Well, stop eating bread then. And that's where we have to look at that psychological aspect of, do I love myself enough to stop having the foods that I know that don't serve me very well? Then things like making sure enough fibers in there, high levels of protein, getting enough hydration in there with good quality water. Are you having too much alcohol? Are you smoking? Are you having processed foods? All these things. Looking at recreational drug use and stuff like that. But one of the big physical things I think is underestimated. We always say you need to do more exercise, that people need to get to the gym. They need to go for a run. They need to do exercise. But yes, you can be under exercising. Many people are doing it. And we need to work on a program to improve that. But I say this from experience that I used to over-exercise a lot. That's how I dealt with my mental health. I would go to the gym once, twice a day, every day. That was not healthy. That was not a good place to be in. But that then caused extra stress, which could be causing reflux as a result. So we have to work with our body from the top down, from the root cause, put the pieces of the puzzle together, rather than just going for medication or anything like that. Or like, let's work with the nutritional side of things. Let's work with looking at your sleep routine. If you're someone that wakes up during the night, then you get straight back to sleep. All well and good. But you shouldn't really need to wake up during the night. But if you do, and you wake up once, all good. Like, you're getting back to sleep and you're getting 8 hours of sleep, 7 to 8 hours of sleep. However, over 30% of the population here in the UK regularly get 4 or 5 hours sleep. That's crazy, especially when you look at a study showing that of 2 weeks or less. or in just 2 weeks, 6 hours or less sleep, you will have your testosterone levels drop by around 10% in the average guy over 30, which is crazy to think about. And so we need to improve sleep. Most people are waking up 2, 3, 4 times during the night. And then they're kidding themselves that they're just getting to that age that they have to wake up and go to the toilet. Are you waking up because you need to go to the toilet, or are you going to the toilet because you're waking up? Our body should be able to, unless you're having a gallon of water before bed, but it should be able to sleep 7, 8 hours during the night without waking up. And then what we have to recognize is just because something is common doesn't make it normal. Just because so many people are stressed doesn't make it normal to be waking up during the night. Now, there's a lot of things that I've just chucked in here, but if you need extra support with this, then speak to a health professional. That might be myself, it might be someone else, but there are a lot of experts out there. If you want to speak to me, go to www.ojayhealth.com/let's talk, and let's just, or DM me. Let's book in for a call and let's chat through this and see if